Dr. Smith, physical therapist here, and I wanted to make this video on job searching and sign-on bonuses, especially as I have a lot of new graduates reach out to me. So for job searching, I highly recommend Indeed. You can still find PT jobs on Craigslist. I don't recommend it. So I'd say you start with Indeed. You can go to LinkedIn, but my main two resources are Indeed and Glassdoor, and I'm going to show you why here in a second, okay? So we're going to search in Naples, Florida. This is where I grew up. I currently don't live there, but we'll just search for PT jobs here, okay? So physical therapist, Naples, Florida, comes up. And what you can do, what people don't realize, is you can filter by salary over here. So if you see 50,000, 60,000, honestly, to me, I say no. I mean, my first year out of school as a home care PT, I made over $120,000. My PTAs make 75 to 80. If you've taken my course, you've seen my bank statements, so you know I'm not bullshitting you. So what I'm gonna say here is this, okay? If you are going to outpatient PT, I would not take less than 75 or 80. And that's why you can filter this way as well. Also, the reason there's more jobs here is because nobody's probably accepting this. And if you are accepting it, you probably suck as a PT, you don't know your worth, or you have no idea what's going on with the world and somehow you passed your boards. So what I'm gonna say here is let's search for the 85,000 plus. And the problem with this though is some jobs get lumped here because there is no actual pay. And so you'll call or interview and be like, oh yeah, the offer is 60, and it's like, oh, you trapped me. It's a bait and switch. Do you really want to work for a company that does the bait and switch? That's up to you. But we'll go here, we'll click on this, 85,000 plus. Again, home health, obviously. But we'll go to here where we see the sign-on bonus. And I clicked on this earlier for research purposes for this video. So we can see the sign-on bonus here is $5,000. And this is for Naples Community Hospital. I know this hospital because I used to work there 7 to 8 years ago, way before I was a physical therapist. I was a patient transporter. But we can see the bonus here. Now, when you see a bonus like this, you have to think, why do they have this bonus? Can they not get people? Naples is a nice, wealthy area. Is the culture bad? Why would they be giving people this bonus? Now, if it's a rural area, like rural New Mexico, rural Alaska, then the bonus makes a bit more sense because they just don't have anybody. But if it's a wealthy area, then they probably have a culture issue. Now, before you take any job anywhere, any sign-on bonus, I recommend you either have been there as a student on the clinical, or you shadow a person for at least a day, or come in once or twice, make sure you like your coworkers, make sure you like the culture. I've had other therapists reach out to me saying that they hate their jobs, they've thought about killing themselves because they took a $15,000 sign-on bonus and have to be there for 5 years, 3 years, and that's what you want to avoid. You don't want to take a sign-on bonus, especially with a time commitment, and then hate your job, but feel trapped for years and your mental health deteriorates, and maybe you do kill yourself. And it's unfortunate for the profession and your patients because the company wanted to trap you because they knew their culture sucked. They knew they had high turnover, so they gave you a lot of money, and now you're not happy. So the purpose of this video is to make sure all new graduates and those transitioning jobs, other settings are happy. So when you take a sign-on bonus, realize that this $5,000 is going to be taxed. You'll probably take home about $3,000 to $4,000, most likely under $4,000 after the tax laws, and also the business can write this off as an expense as well. So if I were you, after you shadow for a day and you decide that maybe you want it, maybe you don't, see if you can get this added to your base salary over time, or see if there's a 90-day trial before you even get that, because that way you can be like, this isn't for me, I don't like that. I just would not sign anything without experiencing it first because we don't want your mental health to deteriorate and don't want you to feel trapped. Now, that being said, so why are they offering a $5,000 sign-up bonus? This is where you can go on Glassdoor and reference this. So I have it pulled up on Glassdoor here. Sometimes you won't find everything on Glassdoor, but that's when you can ask to speak to current employees, former employees. You can see, whose position am I filling, what's your turnover rate, and don't be afraid to ask these questions. And again, if you don't have your license yet, ask them even more because you're not even going to make the company revenue until you have your license. So it's actually better to get asked these questions before you have your license, or if you just don't care for a bit. So we're going to go and check here and see why the sign-on bonus is so high. So I have it pulled over here. See, great coworkers, terrible pay for the area. I don't know why. So 3 stars. 5 stars, but doesn't recommend. I guess they didn't know how the rating system worked. It's better for working for the alternative hospitals, low pay. So now we see why. So they pay low, the salary's low. It's probably grouped into the bait and switch category that I told you about, where they say it's like 85,000 plus, but it's really not. And so they're giving the $5,000 sign-on bonus because everyone's leaving, everyone's not getting paid their worth, and they're like, I'm done, bye. But now they're offering a $5,000 sign-on bonus, probably for a year or two commitment, and now that's going to be up to you, whether you want to do it or not. But the cardinal rule of all of this, and the purpose of this video, is make sure you cross-reference other websites about the company that's offering the sign-on bonus. Make sure you talk to other employees. Make sure you enjoy the culture so you don't get trapped in a situation where you're there for 5 years, have $20,000 that you have to pay back if you leave, and then you just feel like killing yourself for not going to work. You did not get a DPT. You did not go $100,000 in debt to have mental health issues like that. And unfortunately, this isn't taught to you in school. And unfortunately, companies do prey on you like this. And this is an example of a company that's probably doing that. All the reviews are bad. All the reviews say don't work here. And then you see a $5,000 bonus. So usually if it's too good to be true, it is. Now, if you need extra cash, even if it's a $1,000 bonus after taxes, it's only gonna be $700. Is it really worth it? Probably not. As a DPT, you can go PRN and make that in a weekend. You can make twice that in a weekend. And if you want to go travel, I can put you in touch with travel resources as well. But just take this all into consideration, that if it's too good to be true, it probably is. I'm tired of seeing new graduates get trapped with jobs that are full-time jobs, but they require a commitment. If your job is full-time, there should not be a commitment for a bonus and so on, blah, 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 blah. Just don't take the bonus. Even if you make, $5,000 less this year, is your mental health worth it? That's up to you. So hopefully this video was helpful. If you have any comments, questions, complaints, concerns, let me know. If you need me to help you with your resume, if you're going into home health, I can help you with that as well. But I hope this video was helpful once again. Again, I say use Indeed, reference it on Glassdoor. If you can't reference it on Glassdoor, ask the employer to talk to the former employee, go for a day. And again, don't try to find your job on Craigslist, and stop accepting low pay. If you've seen my Medicare reimbursement videos where even 4 units is generating over $100 for that session, but some of these employers, for example, and this is probably gonna piss some people off, but I don't really care at this point. Some of these employers, for example, ATI, let me pull it up. They're giving you $24 for an hour. Are you kidding me? Even if you build 4 units, if you see my other videos, they are making 110 plus. Yes, they have bills. Yes, they have blah, blah, blah expenses as an owner of the practice. But paying a DPT $24 when they're generating 100 plus, 160 to 200 on evals, get out of here with that. Make sure you know what your license bills. Make sure you get paid your worth. Make sure that if you are going to take a sign-on bonus, you know that you need to be in the area for that time. And stop letting other people walk all over you and the profession and then whining about it when you can be smart from the get-go. Thank you.